We are going to look at the differential diagnosis of acute red eye. Though there are many causes of an acute red eye, but we are going to focus on how to distinguish between the red eye caused by acute conjunctivitis, acute iridocyclitis, and acute congestive glaucoma. Talking about the onset, congestive glaucoma develops suddenly, whereas iridocyclitis and conjunctivitis develop gradually. There is severe pain in eye in glaucoma due to the stretching of sensory nerves, which causes intense, unbearable pain. And also, the entire trigeminal area is affected because the pain is radiated along the branches of the fifth nerve. This is due to the increased intraocular pressure in the eye. But in iridocyclitis, there is moderate pain, whereas in conjunctivitis, there is just mild discomfort. Talking about the discharge, acute conjunctivitis is due to bacterial infection. Therefore, there is mucopurulent discharge. Whereas in iridocyclitis and glaucoma, there is watery discharge. Colored halos are seen in conjunctivitis due to the prismatic effect of mucus, whereas it is absent in iridocyclitis, but is present in glaucoma due to the accumulation of fluid in the corneal epithelium. Talking about the vision, it is good in conjunctivitis, slightly impaired in iridocyclitis because there is inflammation of the iris, but it is markedly impaired in glaucoma because here, due to the increased pressure in the eye, there is ischemia of the optic nerve. So, as the nerve involvement is there, there is marked impairment of vision. Talking about the congestion, from the word conjunctivitis itself, you can know there is superficial conjunctival congestion. But in iridocyclitis and glaucoma, there is deep ciliary congestion. In conjunctivitis, there is absence of tenderness. So there is mild discomfort and absence of tenderness. But in acute iridocyclitis and congestive glaucoma, there is presence of tenderness and marked tenderness because here you can see there was presence of pain and involvement of the trigeminal nerve. Talking about the pupil size, it is of normal size in conjunctivitis, but it is small and irregular in iridocyclitis. Small because maybe there is irritation of the sphincter pupillae muscles because of all the inflammation in the iris, and irregular due to posterior synapse formation, which also leads to festooned pupil appearance in this stage. There is large and vertically oval pupil in congestive glaucoma because there is obstruction of the blood flow to the sphincter pupillae muscles due to the increased pressure. So it is dilated. The media is clear in conjunctivitis, but it is hazy due to keratic precipitates, aqueous flare, and pupillary exudates in iridocyclitis. This also leads to slightly impaired vision here. But in congestive glaucoma, it is hazy due to edematous cornea. The anterior chamber is normal in conjunctivitis, whereas it may be deep in iridocyclitis due to posterior synapse formation. And it is very shallow in congestive glaucoma because the iris is pushed forward due to the increased intraocular pressure. In conjunctivitis, the iris is normal. In iridocyclitis, it is muddy, whereas in congestive glaucoma, it is edematous. Intraocular pressure is raised in congestive glaucoma and normal in the rest. Constitutional symptoms or associated symptoms are seen in congestive glaucoma, which is prostration and vomiting. In others, there is absence or even little presence in iridocyclitis. To summarize, in acute conjunctivitis, there is mucopurulent discharge and presence of colored halos and superficial conjunctival congestion. In acute iridocyclitis, there is presence of moderate eye pain, water discharge, deep ciliary congestion, and small and irregular pupil, which is very important, and then hazy media due to keratic precipitates, aqueous flare, and in congestive glaucoma, it is occurs suddenly, and there is very severe pain, and entire fifth nerve is involved, and there is presence of colored halos, water discharge, marked impairment of vision, and large and vertically oval pupil, hazy media due to edematous cornea, and raised intraocular pressure. That's it for today's video. Do let me know if you like my content by a like, comment and share. And if you want to stay for more content like this, do not forget to hit the subscribe button and the bell icon. Thank you for watching.